A dynamic group of physicians have joined together to unify Black medical doctors, support undergraduate and medical students, and encourage local youth to pursue careers in medicine. The Black Physicians Network of Greater Rochester is a new organization, but it's already making a big impact on the community. We're joined today by Dr. Gina Kyler, president and co-founder of the Black Physicians Network of Greater Rochester, and assistant professor of clinical medicine at the U of R, and Dr. Christopher Richardson, surgeon at Rochester General Hospital and board member of the Black Physicians Network. Thank you for taking time out of your very busy schedules to be here today. How did this all get started?
Well, I think this has been a process that has occurred over several years, but the long and short of it is we wanted to have a resource for the community and students who are interested in careers in medicine to be able to contact and connect with, to ask questions, to have shadowing experiences, tangible role models. And we didn't have that. It didn't exist in this community. And I decided to take on the monumental task of building a database. And I was fortunate to have Dr. Nana Duffy volunteer to help me with that when I realized how extensive the amount of work required was going to be. And after that, Dr. Linda Clark joined us. And we formed the organization, and then we reached out to several of our colleagues, Dr. Richardson included, and were able to form a board, and we've been working since then tirelessly.
And this is something that's personally important to all of the members. What were your own experiences in medical school? Did you have a support system like this?
Well,
we did not have a support system like this. We did have a dean, a Dr. Jerome Blue, a black gentleman who was at NICOM, and he said when he arrived, he was lonely. There was very little color on the campus. And so he made it his mission to seek out qualified applicants to come to NICOM. And that's exactly what he did. And through his tireless efforts, the late 80s, early 90s, mid 90s, there was a large number of students of color, African American, Latino students at NICOM due to his tireless efforts. And so through his leadership, then we as a group supported each other, study groups, socially, emotionally, to get through the process and to become successful physicians.
Sure.
I didn't have that. I went to medical school here at U of R. I came here in 1988. There were very few Black or Hispanic students at that time, and even fewer Black faculty members. We had the deans at the medical school. Dean Brenda Lee was there when I came, and she was probably one of the only advocates that I really felt I had at that time. But no Black faculty, and my experience was one of pretty much feeling isolated, and the only support I really had was from other colleagues, other students. Upperclassmen tried to encourage some of the first and second year students, but nothing that I could ever say I had a mentor or a role model to say this is how you do it, this is what you should be mindful of.
And what's your target age? Who are you trying to reach? You guys have done events at elementary schools, backpack drives, that sort of thing. So we're talking about little kids. Why is that important?
I think we see that, there's a lot of data out there that shows that you really need to get to kids by 4th grade. And we know when it comes to high school dropout rates, they skyrocket at 9th grade. So in order for you to, achieve your dream of going to medical school and becoming a physician, first I need you to finish high school. And to get you to finish high school, I need to start having conversations with you, whether you're in pre-K, elementary school, anywhere along that educational pipeline where I can solidify in your mind the fact that this is a dream that you can achieve, and I can start to put the tools before you that can help you to be able to fulfill that dream. So to answer your question, anytime from birth to the time you graduate from medical school, that's our target.
What is the reaction from the kids and the parents when you're out in the community?
I think the children are enthused. My way of speaking to them is not as some physician that is all high and mighty, just as another human being. Address them as such. And children, they are very keen, and they pick up on you, what your style is, and if you're being honest with them, and then they're able to relate to you and understand that you want them to be just like you. You want them to be better than you. And they're very, very enthusiastic and love it when we speak to them, not just about being a doctor, but about being anything that they set their minds to, they can achieve.
What do you think some of the barriers are when kids have dreams of careers in medicine or anything else? What are some of the barriers?
Barriers are numerous. There are financial barriers, but I have come to learn that that's the smallest portion of the barriers that they deal with. A lot of it is a lack of tangible role models, them not being able to visualize themselves in that career, a lack of support at home. We've encountered parents who, to my surprise, discourage their kids from finishing high school, finishing college, encourage them to pursue jobs that are available now, which oftentimes are, minimum wage jobs, not realizing that those kids will be destined to stay in those jobs for the rest of their lives. I think that a lack of information is another challenge. Oftentimes people aren't aware of what resources are out there for them, what opportunities are out there, even what careers there are in medicine. So there's a vast number of barriers that the young people face. Even if they make it to college, barriers exist for them in terms of buying books, affording all those other things. Even if they get a scholarship to go to college, now you have to buy the books, now you have to have the transportation. So there are hurdles every step of the way along the educational pipeline, but they're known hurdles, and they can be addressed, and that's one of the things that we're hoping to be able to do.
And so through mentoring, through being a role model, what are some of the other things, activities that the Black Physicians Network is engaged in?
We have shadowing experiences where a young person in high school or college can come and spend time with a physician in the office for a few hours, be able to see what we do on a day-to-day basis, ask questions, and also share with us what their dreams are, and we're able to connect them with people like Adrian Morgan over at the University of Rochester, who's great at helping kids prepare themselves to be competitive candidates for medical schools, just letting them know what they need to be thinking and what they need to be doing at all times to prepare themselves for that application process. We have fundraisers, we had the back to school supply drive. We have networking events where we try and bring younger students together with some students who are further along the educational pipeline so that they can share information about some of the challenges that they face and how they've been able to overcome it. And we also have community networking events where we can talk to community members and build relationships and have the ability to work as partners together to lift up the youth in our community.
Also too, I'm sorry to interrupt, also too, I think we, working within hospital systems, we're able to go to hospital administration, hospital boards, express to them some of the issues that are occurring in the community, what's lacking in the community, and to open their eyes so that they are able to better assist in general.
Why is diversity in the medical field so important?
I think a lot of our colleagues, their mother was a physician, their father was a physician, uncles, aunts, grandparents, they were physicians. So many of us, people of color, maybe our parents were the first ones to go to college, or maybe we're the first person in our family to go to college. So you don't have that personal role model of someone that is in medicine achieving. And so we are the reminder or the example that yes, you can be a physician. Yes, you can be whatever you want to be if you set your mind to it and you prepare.
As far as the shadowing goes, have you had an opportunity to have a shadow with you in the operating room? How does that work?
I have had high school students join me in the office, in the operating room. I have had college students join me in the office in the operating room. I've had postgraduate students who are trying to go to medical school, PA school, come to my office, shadow me in the office and the operating room. I personally open my doors quite a bit to folks, minority as well as majority, to anyone who's willing to learn.
Same here. I can name at least a dozen students that have been through my office this year, and we really try and make sure that they have the opportunities. But to add to what Chris said is diversity is important in medicine in terms of physicians because patients are diverse. And it's important that the people providing the care are representative of the people receiving the care, because then we can have a full understanding of what the needs and issues are of the various patient populations that we take care of. Only with diversity can we be the best that we can truly ever be.
Are you guys partnering with any other community organizations?
We really have a lot of partners right now. We have sponsors that have been working with us. Northwestern Mutual has graciously agreed to be a sponsor of our organization. University of Rochester and Rochester Regional Health are sponsors for us. And we're very grateful for that. We've been working with anyone in the community. We've been invited into the schools, even schools in the suburbs. We've talked in the Webster School District. Both of us have done that. And we're really here for anyone who feels that they would benefit from anything we have to offer them. We want to see the kids in this community, in the city and in the suburbs, thrive. We know that some populations have greater needs, and that's why that's our primary focus, but we're really here to help the youth in our community.
How can the community get involved and help out, or if another physician is looking to join the group, how do they place membership?
As a physician, if you want to see the community around you thrive, come to us. Partner up with us. Help us be the change you want to see.
They can reach out to us. You can email us at blackphysiciansnetwork@gmail.com. We accept donations, school supplies, monetary supplies. They can refer a young person that they may have spoken to who wants to be at some point in the field of medicine or wants to be a physician, refer them to us. You can host a networking event. There are many ways that we are able to partner with others in the community. You can invite us to come and speak to students. We're happy to do that and share our path and our challenges to our current careers. We welcome that opportunity because we know that only together can we make a difference.
And how many members do you have currently?
Right now we have over 60 practicing physicians. We have about 2 retired, and then we have our residents who are also physicians in training.
Is it difficult to get everyone together with the schedules and the demands?
It's very, very difficult, I would have to say. It's very challenging, as you can tell, because we're all busy practicing physicians, and many of us have young families, and so that's another layer that we have to contend with.
But this is what we are passionate about. So we make the time to be that change. Also, too, Jeannie didn't mention that we are, if you do donate to our organization, it is tax deductible.
We're a 501c3 nonprofit.
Yes.
Wonderful. Well, thank you both for coming on today, spending time with us. If you'd like more information about the Black Physicians Network, they're on Facebook. You can also visit their website, blackphysiciansnetwork.org, or send an email like Dr. Kyler said. Again, that email address is blackphysiciansnetwork@gmail.com. Thank you for joining us on this edition of CityWise. I'm Tiana Stevens, and we'll see you next week.